Hi, I'm Dr. Terry Chambers, and today's blog is about chiropractic rehab and what it is and why it's a little different than regular physical therapy or exercises you may do at home at the gym or at another office. In order to understand what we do as a chiropractic physician, we look at rehabilitating the muscles. You need to understand why it's important to even talk about something like that. When you have an injury to your neck, such as from a whiplash or from a sprain, it is the ligaments that hold the bones in place that often become unstable and causes the instability that you often develop with your neck and upper back. Soft tissue injuries are the injuries that occur to everything but the bone. So it's not just the ligament and the muscles, but it's the tendons and the tendon attachments. So when you undergo chiropractic manipulation or chiropractic treatment to realign the vertebrae, what holds that vertebrae in place is the actual ligament that forms the capsule that holds the joint where it belongs. In order for the bone to move or for the bone to become misaligned, that capsular ligament has to be strained or stretched. And it's not like a rubber band, it's more like a plastic bag. So if you pull a rubber band, the rubber band will come in and come out, but a plastic bag, once you stretch it, loses its integrity and is not the same as it was before it got stretched. And that's what happens with ligaments. So a lot of people are involved in injuries or accidents, sprains, strains, and the condition seems to be always reoccurring. And the reason is that the ligament that holds the joint in place has become unstable and is no longer able to support the structure. So what you have to do once you realign the vertebrae is you also must go in and allow the ligament to scar down through exercises and specific types of rehab in order to accomplish that goal. Now, a lot of patients go to different physicians or different providers who do not realign the vertebrae and do not any kind of forms of real manipulation. So when you do your exercises, if you go in yourself at the gym or if you go to a facility that does not do chiropractic adjustments, you reinforce the misalignment by strengthening the muscles and ligaments. And sometimes what will happen when you do that, you don't notice as much improvement with the range of motion or improvement with the overall muscle integrity. So what is my point here? My point is that getting an adjustment is good, but also going through an exercise program designed specifically to strengthen those ligaments which allow that bone to move is even more important. The problem is it takes about 4 to 6 weeks for that ligament to scar down. So today's blog is about making sure that when you get your adjustments, you do your exercises so that it'll scar down in a proper way that the bone will stay in place, you'll no longer have pain, and it won't come back in 6, 7 months or a year. I'm Dr. Terry Chambers. If you have any questions, be free to give me a call at 304-263-4927 or check our website at chamberschiropractic.com. Nice talking to you. I'll see you next week. Bye.